So the floor now is yours for questions, either to all the speakers or one of them, if they are more technical. Please, let's start from here.
Thank you. I am Vita Rufat. I come from Spain, from Valencian community. Thank you for the panel. It was really nice. And I have a question for Maria del Mar. I work in public health, and my question is, there is some application about these indicators. The first question is, the indicators, women indicators are the same of many indicators, these indicators, or and for example, one practice application about this indicator, I have thinking in the diagnosis of the community health or something similar. If you speak more about this, thank you.
Thank you for your answer. Well, the main application of this frame is to put the indicator in a map, and we use the gender gap. It is the differences between men and women, or women and men. But in several occasions, we don't know the data to calculate it. And we use the proxy indicators. It is very common at the local level that we don't have many data about this or one specific indicator. One of the applications we think is to show the differences, the gap in the indicators about health and its determinant at the local level, and show it to political decision in the local level, and ask why it is occurring in this area.
My question is to Sabine. Did I notice it right that you didn't put a gender that you didn't put sex and gender into a module on cell biology and on tissues and organs? Is this a reason?
Yes, indeed. Because actually this is a lecture that is held from one of the colleagues as well from the Institute of Gender and Medicine, who does basic research like on gender and sex differences, together with one colleague from the Institute of Biochemistry. So they actually have a research project together, like how, on gender differences in this subject.
So these things that we heard in the previous sessions are discussed in those other lectures?
Exactly.
I have a question to Sibylle. I'm wondering if there are, so you look for differences, gender differences, or differences between women and men in feelings and comfort feeling, let's say. Do you also look at gender differences in the need for such sensors?
Yeah, this is what we found out during conducting this project, that it has to be asked in the questionnaires as well, if there is acceptance for the technology and if men and women are interested in using this technology. Yes, for sure.
So I want to congratulate the panel. I found every talk really very interesting, and especially the young people. I'm glad that the next generation is coming along to do this work, and everybody's work was great. I wanted to ask Sabine, so this is great. I hadn't realized that Vera has gotten this through. This is wonderful. Then there is a European project. I'm not quite sure what it's called, but now these same integration of topics into the curriculum are being spread across Europe, is that right?
Actually, like the first step was to actually spread it in Germany. We have one kind of association for medical schools, and there's like an NKLM, that's like the National Competency Learning Objectives Catalog for all medical faculties. And like within this national catalog, we actually try to integrate gender and sex aspects. So that's like the German level. And then, as you said, there's this other project that just started, kickoff meeting, I think it was 1 or 2 months ago. So that will actually try to spread it over Europe. So,
You sending out advisors or something? So if a medical school, if there are people from medical schools here, can they just implement what you've done? Will you be advisors so that people don't have to figure this out themselves?
of course, actually, we had 1 week ago in Germany, also back at Berlin, we had actually a conference of all the equal opportunities officers of the medical schools of Germany. So we presented also our results, and of course, we advised them how they can actually realize to have those results also in their medical schools. But of course, Berlin has actually some advantages as we have the Institute of Gender and Medicine and we have the female deans and we actually have this grant for a person that kind of does this work, and most of the other faculties don't have the financial resources actually to be able to do this constantly. So we are lucky for that, but still we had like this conference, so we of course give them advice and we will follow up on that. Mm-hmm.
Thank you very much, Karolina Kublitskiene, and I am from the Karolinska Institute, Stockholm, Sweden, and I congratulate with the education, and I think it's a great focus on that. However, I would like to ask you, because of course the curriculum are different between different countries and universities, and to keep this sustainable, I would like to ask you how you are coping to promote sex and gender aspects between the different teachers, because actually it's a very little what you're presenting and we are presenting at the Karolinska Institute, and I assume the other universities at the Canada and so on. I think the strength would be that we also educate the other specialities teachers, because to keep this sustainable, because it's quite a little thing that we're starting. And my question is directly what you're doing to improve also sustainability by educating the other medical professional people in your university, if we could.
Well,
Okay.
yes, it's actually one of the problems and one of the weak points actually to make it sustainable. But what we try to introduce now, like all new colleagues have to pass like a didactics training when they start to work at university. So one module within the didactics training and how, like their teaching methods will be like on gender and sex aspects in their field. And like we also have once a year a training on gender specific medicine that is actually open for the whole faculty. Okay, the different institutes have to pay a little bit. So where we have different inputs from the different institutes and fields on the gender specific differences for nephrology, for all kind of different fields. So this is one of the actually measures to give the knowledge, pass the knowledge on to other colleagues. And for the sustainability, as we are doing this already now for a couple of years, we have like already group of professors who are interested in doing actually themselves research in this field. So we hope they will keep on doing that, and that this is our resource of keep it sustainable. And what's also important that actually the young students themselves, they are more and more interested in that as they hear like in the first week of their studies on gender differences in clinical medicine, that it's important for their diagnosis and treatment and their future medical work. So there's also like the students that actually ask for those knowledge or for this knowledge.
My name's Joy Johnson. I'm the Scientific Director for the Institute of Gender and Health at the Canadian Institutes of Health Research. And one thing that's often assumed when I tell people about what I do is that the Institute of Gender and Health is interested only in women's health. But men have a gender too, as we know. And one thing that I thought was interesting, and I thought that was a nice metaphor from Anne-Sophie Godefroy's analysis that we could be Tasmania or we could be in the center. And a lot of the analyses here also provide some reflection, obviously Charlotte's more obviously, on the area of men's health as well. I mean, every one of you are providing, I think, really interesting examples about how, when we study gender, we also need to think about implications for men and men's health. And we haven't at Gender Summits talked about that a great deal thus far. So I think that's an interesting thing for us as we move forward to be talking about and to be putting on the agenda. And I'm just wondering if any of the panelists, even though you hadn't necessarily highlighted those issues, I'd be interested from a curricular issue, from a measurement issue in terms of food, for example, or even from the technological issue, if there are also additional insights that we could gain and might be important to highlight vis-a-vis men's health.
I can say something to men's health, as I have a lot of male colleagues, and I begin to talk about gender, integrating gender aspects, they all say, but now you only talk about women's health, don't forget us men. So actually, we always, and also in our module planning sessions, we try to justify our work that, of course, it's not only in order to improve women's health, but also men's health. And in this training course that we have once a year, there's one male colleague who is actually talking about gender difference in prevention. And his speciality is really like the differences of men and women in prevention of diseases. He's working for one of the German ministries, not in an academic institution. So, and we integrated his knowledge also in the curriculum. So it's a very important point to justify or to convince the male colleagues that this is an important issue.
I will take the very last question and then I will let you go, otherwise you will be angry and hungry. So, please.
Just good afternoon. Sorry, my name is Gillian Bowser from Colorado State University. And I'd like to thank the panelists for an interesting discussion. Yet it strikes me that the discussion of diversity has not been brought up at all. We know that African American women, for example, have different health rates than their European counterparts. And we know that health disparities differ by race and by ethnic and by culture. And the intersectionality of gender and race is something that is extremely important for the health field to be aware of and certainly to be teaching. So I guess one of my questions or challenges is how are we looking at the discussion of gender plus diversity in these conversations? Because it has not come up much in this summit yet, in the earlier panel or today, on when those two things collide. And when we take the Gender Summit to Africa or to Asia, we're bringing in different cultural mixes and different ethnic mixes. And what do we do about gender plus diversity, and when those two actually make for differences in health, in human health, in teaching, in retention, etc.? Thank you.
I don't know if anybody wants to answer to this, but I would take this as a conclusive note, because really, I mean, that's food for thoughts for everybody. So I would just take it as a hint for all of us. I don't think we have a ready answer for you, but thank you so much for this as well, and thank you to all the panelists. It was really great to be here today, and I give the floor to